LeRoy Carhart. LeRoy Carhart is an American physician who specializes in obstetrics and gynecology. He is known for providing late-term abortion services, particularly in cases where the pregnancy poses a threat to the life or health of the mother, or when the fetus has a fatal anomaly. He has been involved in several high-profile legal battles related to abortion rights, including the 2000 Supreme Court case Stenberg v. Carhart, which challenged a Nebraska law banning partial birth abortions. Carhart has also been the target of protests and harassment by anti-abortion activists. LeRoy Carhart was born on March 4, 1941, in Indiana, USA. He earned his medical degree from the University of Nebraska Medical Center in 1972 and completed his residency in obstetrics and gynecology at the University of Minnesota in 1976. Carhart gained national attention in 1991 when he began providing abortions at his clinic in Bellevue, Nebraska, and later in Maryland. He became known for performing late-term abortions, which are generally defined as those that occur after 20 weeks of pregnancy. Carhart has been an outspoken advocate for abortion rights and has argued that late-term abortions are sometimes necessary to protect the health and well-being of pregnant women. He has testified before Congress and in court cases, and has been a frequent speaker at medical conferences and public events. Carhart has also been the target of protests and harassment by anti-abortion activists. His clinic in Bellevue was the site of a deadly shooting in 1994, when an anti-abortion activist killed 2 of his employees and wounded several others. Despite the risks and controversy surrounding his work, Carhart has continued to provide abortion services to women in need. He has been praised by many in the medical community for his dedication to reproductive health care and his willingness to stand up for women's rights. In conclusion, LeRoy Carhart is a highly respected and controversial figure in the field of obstetrics and gynecology. His work providing late-term abortions has made him a target of harassment and violence by anti-abortion activists, but he has remained committed to protecting the health and rights of his patients. Carhart's advocacy and expertise have been invaluable to the reproductive health community, and he has inspired many with his courage and dedication to his patients' well-being.